Which of these people has a drug addiction? If you picked the stereotypical addict, you are wrong on all counts. I'm Deepak, clinical psychologist, who will be busting three dangerous myths. It is very easy to pick a person with an addiction out of the crowd. The fact is, not every person with an addiction fits the stereotypical picture in your head. Many individuals with a substance use disorder have jobs and families and look just like you. The truth is, addiction can happen to anyone, no matter their race, upbringing, personality type, or grade point average. Just think about it. Would you automatically know if your coworker was diabetic? Of course not. Same with addiction. The person sitting next to you on the bus, your child's teacher, even your doctor, any of them could be struggling with substance use disorder while appearing completely normal. What makes this myth dangerous is it makes people think that I can't be addicted because I don't look like an addict. Myth number 2. Only hard drugs like cocaine and heroin are addictive. The fact is, while drugs like cocaine, heroin, and methamphetamine are definitely dangerous, prescription medication can be just as addictive. Addiction to prescription medications, including painkillers, sedatives, stimulants, is a serious growing problem among all age groups. These drugs can be highly addictive and have serious harmful effects. Even if these drugs are prescribed by a physician, they may pose risk. And here is what's shocking. Alcohol is one of the most dangerous and addictive substances, yet legally and socially acceptable. Myth number 3. A person can only be addicted to one substance at a time. The fact is, this is one of the biggest misconceptions. Polydrug use, the simultaneous use of multiple substances, is common among individuals struggling with addiction. This can complicate treatment and recovery because different drugs can cause varying withdrawal symptoms and require different treatment approaches. Why does this happen? Remember, addiction hijacks the brain reward pathway. Once the pathway is compromised, it becomes vulnerable to multiple substances that triggers the same dopamine pathway. What makes this myth dangerous is that it makes people think that they are fine until they are not using their main drug, while they may just be substituting one addiction for another. These myths aren't just wrong, they are deadly. They prevent people from seeking help, creating shame and stigma. The truth is, addiction has nothing to do with a person's character. There are genetic, social, and psychological risk factors that can put some people at greater risk, but addiction affects people from all walks of life. If you suspect someone has an addiction, approach them with compassion and not judgment, understanding it as not a moral failing but a medical condition which requires professional help. Addiction is a devastating disease with a high death rate and serious social consequences. But if we replace myths with facts, we can save lives. And recovery is possible at all stages of life. Subscribe for more such informative videos.